how does that vagus nerve, how does it influence anxiety, inflammation in the body, stress, and what are some common signs of like vagus nerve dysfunction that you're seeing in the work that you do?
Let's start with anxiety and stress. Let's step one step back. Let's start with inflammation.
Mm.
Inflammation is incredibly important. It's good for you if you get an acute bacterial infection. It is extraordinarily damaging if you are exposed to chronic inflammation. And this is a backdrop that we all have to get on the same page about.
Yeah.
That's why people tell you to eat an anti-inflammatory diet, to lose weight, to do certain things that keep your inflammatory levels down. It's associated with cardiovascular disease. It's associated with cancer. It's associated with pulmonary disease. It's associated with a myriad of different disorders. So acute inflammation can be good. Chronic inflammation is extraordinarily damaging.
Yeah.
Now, what people don't recognize is that teleologically, your body has recognized that this is bad and has developed ways of blunting the inflammatory response. The key one that people don't know about is the vagus nerve. The vagus nerve has both central, going up to the brain, and peripheral, going to the spleen, the gut, and other areas, direct projections to the various cells in your body, what's called the macrophages and the microglial cells in your spleen and in your gut and other areas, that these cells produce inflammation. There's a reflex that when there's inflammation going on, the brain gets information up to the nucleus tractus solitarius, which you will know if you're a PVI person. It's the area of the vagus nerve cell bodies. It goes up there. There's information that's processed, and then information that goes right back down. And in that information, it says, turn off that inflammatory response. Turn it down. And that is incredibly important in mitigating what's called the cytokines that are associated with stress responses. So studies are going on, and we talked about rheumatoid arthritis. There are studies with inflammatory bowel disease. There are studies with diabetes and control with the efferent vagus nerve stimulation. But interestingly, there's also work going on with afferent stimulation. Back in 1997, the first implanted vagus nerve stimulator was approved for epilepsy. And they realized very shortly thereafter that patients with major depression were getting better. They actually got an FDA approval for depression back in 2005 because with an implanted vagus nerve stimulator. Now, it's rarely used because they're very expensive, they carry risks, etc. However, it's been recognized for quite some time that the VNS, the vagus nerve, actually controls depression. Also, we've published a paper. I don't actually think it's out yet, but it was accepted for publication on external VNS, non-invasive vagus nerve stimulation in patients with sleep and anxiety disorders. And on average, when people are asked on a scale of 1 to 10, how much did you help with your anxiety and your depression and your sleep disorders? They reported on average about 8 out of 10. So really profound improvement.